I am Mandana Vahabi. I am the full prof at Lawrence Bloomberg Faculty of Nursing at U of T.
My name is Vijayshree Prakash. I'm an international medical graduate and I worked as a project manager for this project titled Prevention of Cervical Cancer in India.
India has the second leading cause of mortality due to cervical cancer. So that was the reason that we became really interested trying to promote cervical cancer screening.
Through this project, we wanted to see if using HPV self-sampling can be implemented in small, low-income communities or rural communities in India.
Rather than for a woman to go to a physician to do the test, they can do the test at the privacy of their own home, at the place that is more convenient for them. The actual thing looks like this. It's just like very easy for them to go to the bathroom, insert, and then give it to our personnel in order to take it to the lab.
They have all the factors that make access to healthcare difficult, like long commute to the healthcare centers, having no healthcare providers, depending on male partners to go for HPV screening.
In countries like India, men do make the final decision as it relates to health and other aspects of life. So it was really important for us to include their male partners. So one component of our innovation was to promote their knowledge and change their attitudes surrounding cervical cancer and screening. And we looked at 3 villages which had the lowest cervical cancer screening, and their literacy level was quite low as well. So we felt that we should create educational materials about cervical cancer and screening that is art-based.
PowerPoint with a lot of pictures, storyboards, movies, and videos of how to use the self-sampling. So we had this tailored to both groups, men as well as women, and then brought them together so that they could talk comfortably to each other about deciding to getting screened.
We couldn't really done this project without the help of our partners in India, which is the Tata Memorial Hospital, particularly Dr. Gauri Mishra, who was instrumental for making this project possible. Well, the first thing that we learned is that without providing the necessary knowledge that is important for people to know why they should actually take on a test, it would be really useless. Providing those art-based education about cervical cancer, what are the risk factors, how we could actually try to identify the disease at the earliest stage, it really did help to improve their knowledge. So of 120 women, 115 of them opted to use HPV self-screening. 3 of them decided either to use pap test or VIA, and 2 refused to actually do any kind of testing there.
We are implementing some of the findings from this project into our current project, which we call WeCan, Women Empowerment Cancer Awareness Nexus. WeCan is being implemented in 8 states in India. This project again will have a component to promote cervical cancer screening, and this is in alignment with the goal of eliminating cervical cancer by 2030.
We want to actually focus on commercial sex workers in India. Their access to healthcare is very restricted, and also they are at higher risk for cervical cancer. Why does it matter to me? Because I think people's life matters, not only to me, to everyone.